We all know that the ongoing problem with the Adderall shortage has been causing headaches for patients and healthcare professionals alike. Patients are stuck calling pharmacies and hoping that one can fill their prescription, insurances are denying coverage, and prescribers are sending multiple scripts throughout the day. Some of you might be in a situation where you may have to find suitable alternative medication to manage your ADHD symptoms. That's why we'll be discussing and learning about a newer medication called Mydayis, what some people are referring to as Super Adderall. And who am I? My name is Dr. Sulman Aziz Mirza. I'm a triple board certified psychiatrist specializing in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And this Adderall shortage is going to send me into early retirement. If you're enjoying what you're watching, hopefully learning some things, make sure to stick around to the end to hear what my patients are telling me about Mydayis. Hit the like button and don't forget to subscribe for more content like this. I've got lots of ADHD content and we are going through a bunch of different medications and doing a deeper dive into their pros and cons, like this one. So what exactly is Mydayis? Mydayis is a prescription medication that has been developed specifically to treat attention deficit hyperactivity disorder, commonly known as ADHD. It belongs to the family of central nervous system stimulants, which are designed to help manage the core symptoms of ADHD, such as inattention, impulsivity, and hyperactivity. It is approved by the FDA for use in patients aged 13 and above. Mydayis contains mixed amphetamine salts, similar to Adderall. However, what sets it apart is its unique long-acting formulation, which is designed to provide a steady release of the medication throughout the day. This is made possible by the innovative triple bead release technology. This cutting-edge system consists of 3 different beads within each capsule. Each bead contains a portion of the active medication, and they have different coatings that dissolve at varying rates. This results in a more consistent and sustained release of medication throughout the day as the beads release their contents at different times. This means that Mydayis is designed to last up to 16 hours, providing an extended coverage for those who need it. This extended duration of effect is where Mydayis sets itself apart from other medications like Adderall XR and Vyvanse. While Adderall XR typically lasts anywhere between 10 to 12 hours, Vyvanse lasts approximately 12 to 14 hours, Mydayis boasts the longer duration of up to 16 hours in some cases. This is particularly helpful for individuals who may have longer days or require symptom management beyond the typical school or work day. Additionally, this consistent release may also contribute to reducing the likelihood of experiencing peaks and valleys in symptom control, avoiding that notorious Adderall crash, reducing the need for booster doses in the afternoon or early evening, and overall leading to a more stable hour-to-hour, day-to-day experience. Let's get into the nitty-gritty a bit more and dive into the mechanism of action for Mydayis. Like Adderall and Vyvanse, Mydayis is classified as a central nervous system stimulant. These medications work by increasing the levels of dopamine and norepinephrine in the brain. Dopamine is a neurotransmitter that plays a significant role in motivation, reward, and attention. By increasing dopamine levels, Mydayis can help improve focus and attention in individuals with ADHD. Norepinephrine, on the other hand, is involved in alertness and arousal, and its increase can help reduce impulsivity and hyperactivity in ADHD patients. Like mentioned before, while the active ingredients in both Mydayis and Adderall are mixed amphetamine salts, their release mechanisms are different. Mydayis uses the triple bead release technology, which allows for more consistent and sustained release of the medication throughout the day. Adderall XR, however, uses a dual layer bead system, which results in a 2-phase release of the medication. Vyvanse, on the other hand, is a prodrug, meaning it is inactive until it is metabolized in the body. Once ingested, Vyvanse is converted to its active form, dextroamphetamine, by an enzyme in the body. This conversion process contributes to Vyvanse's extended duration of effect, but it also means that the medication's onset of action may be slightly slower compared to Mydayis and Adderall. Now, let's touch on the possible adverse effects and contraindications for each medication. It's important to note that the adverse effects can vary between individuals, but some common ones for all 3 medications include things like dry mouth, loss of appetite, insomnia, and increased heart rate. In rare cases, more severe adverse effects like elevated blood pressure, heart-related issues, or psychiatric symptoms such as mood changes, mania, and even psychosis may occur. Amphetamines are a controlled substance, and there is a potential for misuse with these medications. As with any medication, it's essential to discuss these risks with your healthcare professional and monitor for any concerning adverse effects. Contraindications for these medications are generally similar as well, with individuals who have a history of heart problems, uncontrolled hypertension, or known hypersensitivity to stimulant medications being advised to avoid using them. Lastly, it's crucial to emphasize that individual responses to medications can vary greatly. While Mydayis may be an excellent option for some patients, others might find that Adderall, Vyvanse, or even non-stimulant medications are better suited for their needs. The key is to work closely with a healthcare professional to find the best option for you or your loved one. Wrapping up, Mydayis is a promising option for those looking to manage their ADHD symptoms, particularly in light of the ongoing Adderall shortage. Its unique triple bead release technology, longer duration of effect, and the potential for more consistent system control throughout the day set it apart from other medications like Adderall and Vyvanse. So far in my patients who have tried it, either through the desire for something that's longer lasting due to having to work or study extended hours, or being forced to switch due to access issues, most of them have done great on it and actually prefer it to Adderall and Vyvanse, with the main feedback being that it is a smoother and more even experience for them. I hope that this review of Mydayis in comparison to Adderall and Vyvanse has been helpful for you. If you have any personal experiences or thoughts about these medications, please feel free to comment, share them in the comment section below. Thank you so much again for watching. If you found this video helpful, please give it a thumbs up. Don't forget to subscribe for more content like this. If you have any suggestions for future topics, please leave them in the comments, share them, and we'll make sure to address them in future videos. All right, thank you again, and we'll catch you in the next one.